If you're turning 65 soon, or you're already on Medicare and wondering what changed for 2026, this is the video you need to watch before you do anything else. Because Medicare is confusing enough as it is, but this year, there are real changes that could save you money or cost you money depending on whether you pay attention. And the problem is, nobody explains this stuff in plain English. It's always buried in government websites with tiny font and 100 links that go nowhere. So I'm going to break the whole thing down for you right now in simple terms. No jargon, no fluff, just what you actually need to know. Let's start at the very beginning. What is Medicare and what does it actually cover? Medicare is the federal health insurance program for people 65 and older, and for some younger people with certain disabilities. It's not one single plan. It's actually broken into different parts, and each part covers different things, which is where most of the confusion starts. Part A is hospital insurance. It covers inpatient hospital stays, skilled nursing facility care, hospice care, and some home health care. The good news is that most people pay $0 per month for Part A because you already paid into it through payroll taxes during your working years. Part B is medical insurance. It covers doctor visits, outpatient care, medical supplies, preventative services, and some things Part A does not. Unlike Part A, Part B is not free. You pay a monthly premium, and for 2026, that standard premium is $185 per month. Now that number can be higher if your income is above a certain level, and I'll explain that in a minute because it catches a lot of people off guard. Part C is what most people call Medicare Advantage. These are private insurance plans that bundle Part A and Part B together, and usually include extra benefits like dental, vision, and hearing. Part D is prescription drug coverage. It helps pay for your medications, and this is the part that got some of the biggest changes for 2026. So those are the four parts: A for hospital, B for medical, C for advantage plans, and D for drugs. A, B, C, D, nice and simple. Now let's talk about what actually changed for 2026, because this is the part that matters most. The biggest headline change is the new $2,000 cap on out-of-pocket prescription drug costs under Part D. Before this cap existed, some seniors were paying $5,000, $10,000, even $20,000 a year out of their own pocket for medications. Starting in 2026, no matter how expensive your prescriptions are, the most you will pay out of pocket in a year is $2,000 total. And here's something even better. You don't have to pay that $2,000 all at once. There's a new option to spread it out into smaller monthly payments throughout the year. This is a massive deal for anyone taking expensive medications for things like cancer, diabetes, autoimmune conditions, or any chronic illness. If you're currently avoiding filling a prescription because it's too expensive, this change could literally be life-changing for you. Now let's talk about Part B premiums, because that number went up for 2026. The standard Part B premium increased from $174.70 in 2025 to $185 in 2026. That's about a $10 per month increase, which adds up to roughly $123 extra over the year. Not the end of the world, but it's money out of your pocket, and you should know it's coming so it doesn't surprise you on your first statement. Now here's where it gets tricky: the income-related monthly adjustment amount, which everyone just calls IRMAA. IRMAA is basically a surcharge on top of your Part B and Part D premiums if your income is above a certain threshold. They don't look at what you earned this year. They look at your tax return from 2 years ago. So for 2026, they're looking at your 2024 income. If you filed as a single individual and your modified adjusted gross income was above $106,000 or above $212,000 for married filing jointly, you'll pay more. The surcharges go up in tiers, and at the highest income levels, some people are paying over $500 per month just for Part B. A lot of retirees get blindsided by this in their first year of retirement because they had a big year of income from selling a house, cashing out a retirement account, or doing a large Roth conversion. If that happened to you, there is an appeal process. You can file a form explaining that your income has dropped due to a life-changing event, and they may reduce your premium. Now let's talk about enrollment, because missing your enrollment window is one of the most expensive mistakes you can make with Medicare. Your initial enrollment period is a 7-month window around your 65th birthday. It starts 3 months before your birthday month, includes your birthday month, and extends 3 months after. If you miss that window and you don't have qualifying coverage through an employer, you could face a late enrollment penalty that increases your Part B premium for the rest of your life. Let me repeat that. For the rest of your life, not for a year, not for 5 years, permanently. The penalty is 10% added to your premium for every 12-month period you could have had Part B, but didn't sign up. So if you waited 2 years past your enrollment window, you'd pay 20% more every single month for as long as you have Medicare. The same kind of penalty exists for Part D. If you go 63 days or more without creditable prescription drug coverage, and then enroll later, you'll pay a permanent surcharge. Now, if you're still working past 65, and you have health insurance through your employer or your spouse's employer, you generally can delay enrolling without penalty. But the moment that employer coverage ends, you get a special enrollment period of 8 months to sign up for Part B. Do not miss that window. Let's talk about the difference between original Medicare and Medicare Advantage, because this is the choice that confuses people the most. With original Medicare, which is Part A and Part B directly from the government, you can see any doctor or hospital in the country that accepts Medicare. You have maximum freedom to choose your providers, but you'll probably want to add a Medigap supplemental plan to cover the gaps, and a separate Part D plan for prescriptions. With Medicare Advantage, which is Part C, a private insurance company bundles everything together, often including dental, vision, hearing, and sometimes even gym memberships. The monthly premiums for Advantage plans can be very low, sometimes even $0, which sounds amazing, but there's a trade-off. Advantage plans usually require you to use doctors within their network, and you may need referrals to see specialists, which limits your flexibility. They also have annual out-of-pocket maximums, which original Medicare does not have, so in a really bad health year, an Advantage plan might actually protect you better financially. There is no single right answer for everyone. The best choice depends on your health, your doctors, your medications, and where you live. One important thing for 2026: review your plan every year during the annual open enrollment period, which runs from October 15th through December 7th. Plans change their coverage, their formularies, their networks, and their costs every single year, and what worked for you last year might not be the best option this year. I've seen people save hundreds or even thousands of dollars just by spending 30 minutes comparing their options during open enrollment. It's the easiest money you'll ever save. So here's the bottom line. Understand your 4 parts, know your enrollment deadlines, take advantage of the new $2,000 drug cap, watch out for IRMAA surcharges, and review your plan every single year. If this helped you understand Medicare a little better, hit subscribe, because every week I break down retirement money topics just like this in plain simple English, and I'll see you in the next one.